the first very important type of intervention we can have is to offer supportive therapy. This is not just a nice thing to do, but it actually has been found in several important and well-designed studies and in my clinical experience to work quite well. I want to offer a guess that 30 to 50% of the benefit comes from just normalizing what's going on, from involving family and work environment in understanding and supporting the person, and then getting them involved in emotional support groups and treatment of the comorbidities. And that might be because the stress effects on top of the neurological damage is going to impact substantially on their functioning. So by normalizing, simply explaining what's going on relieves people tremendously. Those of you who have worked with patients with rare illnesses such as fibromyalgia or chronic fatigue syndrome or some of these others that are hard to diagnose and often not even believed will know what I mean by this. Simply normalizing post-concussive syndrome and going through the list. Have you had this? Have you had the other? And they'll look at you with eyes wide open saying, how did you know that? Did my wife tell you? Did my boss tell you? And if you say, no, this is what we expect you to go through after this type of head injury, it will relieve them tremendously, especially when you tell them that most people improve completely within a year, but that they can expect that, especially for the first 6 months, they will have many of these symptoms and they'll have to work on controlling them. But they should find it easier and easier to control these over time. Having the family there during that type of discussion or during a subsequent discussion of this, and also involving the workplace, is going to go a long way in relieving their stress and helping give them tasks that are easier for them to do. Emotional support groups and treatment of the comorbidities are very, very important as well. The emotional support groups, if you can, for people with head injury, if you get enough of those people, or weekly therapy sessions to help them cope with what's going on, the changes in their life, help them have, on the one hand, patience, especially in those first 3 months, but on the other hand, gear them toward a stepwise progression of what they can do to help. And the treatment of comorbidities, of course, very, very important. If they have peripheral pain, they need pain control, which is going to further dampen their cognitive abilities in many cases, such as with methadone or the acute acting pain relievers.